Okay, good afternoon, everyone. Welcome to the second panel of the symposium. The topic of this session is pollutants, toxins, health, and justice. I'm Liu, an assistant professor of occupational and environmental health science in the School of Health Science at Purdue University, West Lafayette. In this session, we have three distinguished presenters, Dr. Gabriel Filippelli, and Dr. Jennifer Lattimore, and Rachel Scarlett. Besides presenters, we also have a discussant panelist, Dr. Alan Wells. So several housekeeping items. First, I appreciate if you could please mute yourself during the presentations. And second, we will open for live QA at the end of this session, but please do feel free to post the questions in the chat box during the presentations. I will be monitoring the questions coming in the chat box. And at the last, the session has live closed captions available for those who may need it. Please also note that the session is being recorded and will be archived on the Center for the Environment Symposium website. Now I would like to introduce our first presenter, Dr. Gabriel Filippelli. Dr. Filippelli is a biogeochemist focusing on the flow and the cycling of elements and chemicals in the environment. This includes his work on pollutant distribution and exposure to human populations and ways to engage communities to reduce their own exposures. He is also an affiliate of the Environmental Resilience Institute, funded through Indiana University's Prepared for Environmental Change Grand Challenge Initiative. Dr. Filippelli directs the Center for Urban Health and is the editor-in-chief of GeoHealth. He has well over 100 publications ranging from technical scientific reports to essays for broader audience. Dr. Filippelli is funded by multiple private and federal agencies and frequently speaks on topics including climate change and children's health. Dr. Filippelli, the floor is yours.
Well, thank you very much, Dr. Liu. I appreciate the invitation and also the participants. I'm looking forward to engaging with you all and our subsequent speakers who are phenomenal. I'm particularly excited to talk to this audience because I have a couple examples of fighting environmental injustice by engaging with communities. And so I'm going to provide you with a couple examples that are local and a number that are range into a global program. But it's all going to be through a relatively narrow lens, and that's going to be through the lens of lead poisoning. The reason why that's, I think, is such an important lens to look through is we know that lead poisoning is still crippling communities around the country and around the globe. And it's one of these situations where the science is relatively straightforward, but we really need community engagement to fight it. The reason why lead is such a pernicious toxin is that it attacks kids' brains. This is just composite scans. Everything lit up in the frontal cortex part of these brains are parts of the brain where the neurons aren't functioning right, or the neural density is low compared to a standard brain. And this is interesting that this is these are young adults who were lead poisoned at birth. Well, when they were young children, at least. And now here they are 15 years later, bearing still the marks of lead poisoning in their brains. And this lead poisoning, it impacts both their memory, intelligence, and impulse control. And ultimately then, of course, their IQ, their economics, their likelihood of committing violent crimes and so forth. So this picture, I think, shows pretty vividly that the two main aspects of lead is that lead exposure can seriously damage brains, and the damage is permanent. These 20-year-olds, or I think these are late adolescents and 20-year-olds, as they get older, decade by decade, they'll continue losing brain function because of the lead in their bodies. And so it's really important to get in front of that. It's a sad testament to public health that we often map the distribution of lead poisoning by mapping the distribution of lead poisoned kids. And the point for public health, you're supposed to get to the prevention side, right? We haven't quite gotten there. And so I'm going to be talking through this about a couple examples of ways that we are at least are trying to get there. The first of all is to present this kind of map, which again is the classic map of let's map out lead poisoned kids. But I'm not mapping this out to show just the grim reality, but rather to start surgically targeting those communities where the burden is highest in the humans and the children, and to try to understand where their exposure is deriving from. To orient you, this is a map of Indianapolis, and these are blood lead levels, average blood lead levels from about 12,500 children that we did an analysis using a database that's present in something called the Reagan Street Institute here in central Indiana. For those who want to orient, this is Meridian Street. So this whole map is kind of turned sideways so we could see this is Meridian Street. This is the downtown, the IUPUI campus, the federal buildings, the convention center, Lucas Oil Stadium. So what I want you to draw attention to is two things. Don't draw attention to this green area in the middle. The reason it's low is no children live there. So you can't map the effects of lead poisoning if there's no children who live there. But the most important one is look at this ring around that downtown area. North side, east side, south side, west side, the same story, right? Kids who are lead exposed to a dangerous level. And so how do you deal with that? Well, the first thing that we did is we tried to look at where these kids are getting exposed and what's the main exposure mechanism. And this is where I hope some of our work, along with some of our colleagues, have helped turn the paradigm on lead poisoning. You often hear people focus on lead paint or lead in water. Super good things to focus on, no question. Those are sources of acute lead poisoning. But this map is a map of chronic lead poisoning. And so it's not so much paint or water. This is coming from the soil and the dust. And the reason these become shuttles for lead is that these soils, urban soils from cities and towns across the country and around many parts of the globe, have taken the burden of about 100 years, a century of profligate lead use and lead deposition in these environments. And soils do one other thing. They actually hyper-concentrate the lead right near the surface. And so that's important, of course, because that's where we live. But that's also where dust is generated from, right? It's generated from surface soils. So we've been able to untangle this contaminated soil and then dust transport and then blood lead poisoning of kids as one of the major mechanisms of this chronic lead poisoning. So that gives us a clue though, right? It's this lead contaminated soil. If we can find where the hot spots are for this and provide communities with vehicles to solve the problem, well, then we're significantly ahead of the game. The only problem is that lead is extremely heterogeneous. So it's not deposited uniformly across a community. I can, from my own house, see that my lead right around our drip line of our house is really high in soil lead, right? But similarly, but 10 feet away, 20 feet away, it's really low. So it's extremely heterogeneous. And we know there's some characteristics we can predict, but others we can't. So that really means that we need to start measuring this environmental health challenge, not at the county level or the census tract level, but actually at the neighborhood level in order to fight this. And so that's the tools that we've been trying to provide to some communities. We've done this in a couple ways. First, we've leveraged the boom in urban gardens to develop this program called the Safe Urban Gardening Initiative. So we had both an insight and a concern. Our insight was that we can use gardeners, their interest in actually being in the soil, to start collecting samples as civic scientists. So they're out there collecting samples, right? And we provide a free lead testing service. And we tell them the results of their values and tell them exactly how they have to mitigate their soils if they have to. Many cases they don't. But we also get the data. This is sort of an agreement. It's a data agreement between a scientist and a civic scientist. And with this data, we actually publish new and new knowledge so that we can start understanding the chemical dynamics of this. We now have, I believe at last count, 2,900 samples that have been sampled for free in the Safe Urban Gardening Initiative, and I get them in my lab every week. Samples of dirt that we analyze and provide the results back to the gardener. This kind of opened up a whole new world to us because we realized that, well, the urban gardening market is a pretty niche market, right? It's more important, I think, to get a picture of the whole, what we call the whole exposome. So people aren't spending all of their time outside. In fact, people spend only about 10 to 12% of their time outside. They're spending most of their time inside, and most of that is in their own homes, right? Especially young children and toddlers, who are the ones who are at most risk of exposure. And so we started bringing the outside in. I already mentioned that soils are a repository for heavy metals like lead, but the shuttle is dust. That's how soil, how some of this material gets into people, is via dust. And about 60% of the dust inside of all your homes is from outside. So we figured, let's start making that connection from soil outside to dust inside. So we developed a dust safe initiative. So the civic scientists now just take their vacuum bag or the canister vacuum, dump it in a container and send it to us. And we similarly analyze this dust for free and return results to them and recommendations as well. We developed this as part of an international partnership. IUPUI is the North American hub of this program. There's Oceania hub as well. My colleagues at Macquarie University and my colleagues at Northumbria University have a European and African hub. And you can go to this site if you want. Don't do it right now. You're supposed to listen to mine and the other talks, but it's mapmyenvironment, all one word, .com. And you can get information about sampling and so forth. But we have now, I think, about 800 dust samples from inside people's homes from all over North America. And again, we provide those results for free for anybody. So you can get on our site, like here. You can toggle to, well, what's the soil concentration of my neighborhood at the drip line? And you can view it through a number of filters. This happens to be percent poverty, where we're trying to assess whether we have enough sample locations at areas with relatively high poverty and hence at relatively high risk. We, of course, being greedy researchers that we are, we got excited by the capabilities this has provided. So we're adding water to the mix and paint to the mix to try to get really that whole exposome story for people's homes. This has been initiated with a new grant from the Housing and Urban Development Agency that Jen Latimer, who's going to speak afterwards, is a partner on with us. And it starts taking us from just the environment. Everything I've been telling you is mainly the environment side, and into people's homes, and also particularly targeted toward those children who and families where there's been a child already identified as lead exposed. So we're partnering with the Marion County Public Health Department to find these children that are in this spot in their lead results where they're not high enough to get really helpful interventions, but they're clearly imperiled. So our program is to go in and really find out in those particular homes, where's this lead coming from and how can we mitigate it? Again, lead is pretty simple if you know where it is. If you don't know where it is, you've got no choice. And then this is just a teaser. And now worms? What's with worms? Well, we started with funded by Indiana University Racial Justice Grant, a BookWorms Initiative, where we partner with schools and kids collect worms. Worms are amazing little biomonitors. Put them in little baggies with desiccant, and they collect them in the school. And we pick them up, analyze them, and return results for the kids. And for every like 10 worms they collect for the class, they get a voucher for a free book from Barnes & Noble's bookstore. And so this is not only identifying a problem, right? In this case, we're using earthworms as little monitors of lead. It's also educating children about their local environment. But finally, it's a mitigation. One of the few ways to mitigate the toxicological effects of lead poisoning is by education. And so this provides an educational intervention like reading, which has been found to be very powerful. It's pretty straightforward. Kids are weird and gross, so they like worms. And so, any kid out there will collect a worm and stick it in a bag and send it to us. And then we analyze it. The reason why we think that this public engagement, and you're going to hear some stories, I think, from the other speakers, is so important, is this self-efficacy really helps communities and individuals fight against environmental injustices, right? If science is not in their community, if science is over here, and it's being done only by scientists and it's being published only in scientific journals, the communities themselves they're not really provided an agency to make a difference. However, if that person and that child is actually doing the measurements themselves, and we've done some analysis that bears this out, they get actually pretty motivated, not only to look at their own environment, but also to share it with their friends and their cousins and so forth. So it starts to crowdsource science and democratize it in hopefully a helpful way. And again, there's the website. If you want to jump on it, it's pretty straightforward. You can say terrible things to me at Twitter. Please don't, but you can engage with me on Twitter. And please do, if you have any questions following up, there's my email address. I'd be happy to engage with you.
Thank you so much, Dr. Filippelli. And I wrote down so many questions myself. I hope I have a chance to do more interaction with you in the Q&A session. But meanwhile, attendees, please feel free to drop your questions in the chat box. Now, I would like to introduce our second presenter, Dr. Jennifer Latimer. Dr. Latimer is a professor and chair of the Department of Earth and Environmental System at Indiana State University. Dr. Latimer's presentation today is Environmental Health in West Central Indiana.
Thank you so much for the introduction, and thank you for inviting me to participate on this panel. Today I'm going to talk about some of the work that we've done in Terre, Haute, and then some of the work that we hope to do in the future. Most of the work that we started in Terre, Haute was focused on urban gardening, or we had small class projects that focused on specific neighborhoods. But then in 2012, we got I can't see my own slides, so I'm trying to figure out how to navigate that. In 2012, we got a portable XRF, and so that kind of changed our ways. It opened up a lot of opportunities for us to increase the way that we sampled in Terre Haute. And so these two maps that are on the screen are lead concentrations for Vigo County. And this was the work of one of my former graduate students, Heather Fox. So we had a slightly different approach. We focused on urban gardening, but instead of people sending us samples, we actually went to their homes and we tried to go when they were available. And so sometimes when people would see that we could give them data right on the spot with the XRF, they would ask us to sample 20 or 30 different places in their yards, which was a lot of fun. It was also really time consuming. So Heather's data set includes not just samples from residential areas, but also from parks and right-of-way samples. Also, all of the abandoned properties in Terre Haute were sampled at the time because the city gave us actually a list of all those properties and gave us permission to sample those. So in these maps, the orange and red colors are areas that have pretty high soil lead concentrations. And in contrast to kind of what we expected, we didn't find a strong relationship between roads, for example, or point sources, but instead we found a really strong relationship with drip line samples. So the map on your right is a map of only drip line samples, but then kind of interpolated for all of Vigo County. And what we see is that there are extremely high lead concentrations in soil. So in some residential properties in Terre Haute, we're getting values over 30,000 ppm beneath drip lines. where 400 is kind of the residential closure value. So if we wanted to build a new property or build a new home for residential purposes, right, soil concentrations would have to be below 400. But really, we start to be concerned about urban gardening when we get into the greater than 100 to 200 ppm. So there are large parts of the city that are not, they don't have great soils for urban gardening. So we found the highest lead concentrations in older neighborhoods. And Heather also tried to identify where all of the lead was coming from, using a lot of different spatial tools. And the best predictor of whether or not you had soil lead in a neighborhood was the number of abandoned lots. So as the number of abandoned lots increased, then the likelihood that you had elevated soil lead also increased. Now this is kind of an intuitive result, I think, that neighborhoods that have older homes, neighborhoods where you have rundown homes, are places where you might expect to find a lot of soil lead. But one of the concerns is that in this kind of era where we're adding new community gardens everywhere, the places where we choose to put these community gardens are oftentimes in these abandoned lots. So we have a newer indicator of neighborhoods that might be at risk if they have a high number of abandoned lots. So this is a map, another kind of version of lead concentrations across Vigo County. And the red values are, again, they're all soil concentrations that are over 400 ppm. And the dots represent children who have historically suffered from lead poisoning. And so this is not data, this isn't even recent data, this is data that was collected over many years. And so we find that in places where we have high soil lead concentrations, we have a lot of children who are lead poisoned. The problem in Terre Haute and in a lot of cities like Terre Haute is that in these older neighborhoods, these are dominated by rental populations. And so people are moving constantly from home to home, and it's difficult to identify where a child was actually lead poisoned because they've lived in multiple places, even though they've been in the same kind of general neighborhood. So last year, I started a new project where it's with a bunch of different colleagues from mostly smaller universities and liberal arts colleges that just happen to kind of be situated on the I-70. And so we created what was called the Metal Redlining Network. And our goal was to look at these different cities that have redlining maps and to sample them intentionally to try to understand how redlining has had a legacy effect on soil lead concentrations. Well, unfortunately, most of us were going to be doing our work last spring, and then COVID happened. And so we weren't able to go out and collect new samples, although I have students who are doing this work now. So we took Heather's data and we reevaluated it in terms of redlining. And so in these maps, the areas that are kind of red and yellow are areas that were undesirable. Terre Haute has a lot of undesirable areas. A lot of the red areas that you see are areas that are still industrial, a lot of them. But we see this, we see high soil lead concentrations in these red and yellow areas. So this is the downtown area, and then this is Indiana State University. So if you remember back to what the lead poisoning data looked like, we had these kids being lead poisoned, right, in the same kind of area where we're seeing these high soil lead concentrations, which also happens to correspond to areas that were undesirable properties when these redlining maps were created. So again, another place to potentially, we might consider looking at these redlining maps to look for areas that might be at greater risk. So one of my kind of interests in policy is to try to understand where and why or how kids are getting tested for childhood lead poisoning, because as a state, we don't provide enough resources really for all of the kids who should be tested to be tested. And so when we look at maps like this, we can see that in places like Marion County, we have a large number of kids who are being tested. In Lake County, there's a large number. Lake County is where East Chicago is. that is a priority area for the state health department. Other places like St. Joseph's County, places like Monroe County. So places where there are often universities, but also where there are kind of strong community-driven projects to increase the number of kids who are being tested for lead poisoning are occurring kind of in these places. So this is data from the CDC for 2017. In 2019, the numbers kind of keep going up. So Marion County had almost 15,000 kids who were tested in 2019, but there are still 9 counties around the state that have fewer than 100 children being tested annually. And I should also mention that in this map and in the next map that I'm going to show you, the dots within the counties are just randomly placed in the counties. There's no spatial component to what the dots actually represent. So when we look at the next map, which is a map of the percentage of kids, I think the trends are dramatically different, right? So overall, we're not really doing a very good job. Even in places like Marion County, where we're testing a large number of kids, we're still not testing a large percentage of those kids. I live in Hendricks County, so we're only testing 4% of the kids in the entire county. And one of the problems in Hendricks County is that we don't have a lead testing program. So if we don't have a lead testing program, there's not an incentive to test a lot of kids. We don't have a lead poisoning problem in children. And so there's a lot of unknowns, right? In some of these counties, there's a county down here that only has 2% of the kids. Right? So we need to do a better job of identifying the kids who need to be tested for lead poisoning. And we aren't really going to make progress in this area until we stop waiting until a child is poisoned. So here's another graph that I created. So the purple bars represent the number of kids who were on Medicaid. So for the up to 2018, these are the kids who are 0 to 24. In 2019, the data was reported a little bit differently. And so these are the kids that are 1 to 2 years. So that's kind of the drop in the number of kids on Medicaid. But we're required to test all of these kids, right? All of these kids are required to be tested at the age of 12 months and 24 months. And then these stars down here represent the number of kids on Medicaid that we're actually testing. So kids that we have identified at high risk for childhood lead poisoning are not being tested. So one of the, Gabe talked about paint and dust and things like that as being a source of lead poisoning or potential lead exposure. One of the things that we don't think about is the lead that's just in our waterways. And we've been testing fish and also otter tissues. And we've been a little bit alarmed by the amount of lead that we're finding in otters. So fish don't really care about metals, but otters accumulate, they eat about 1 fish per day, which is far more than most people eat. But they have extremely high lead burdens in their bodies. And so all of these red dots that you see on this map are instances where the Indiana Department of Environmental Management has taken a sample at some point between 2010 and 2018, and they found elevated levels of lead. And so if there's lead in the water and these water sources, there's probably lead in the fish. And there are a lot of people who are actually eating fish that they catch. And it's a major source of revenue for the Department of Natural Resources to buy a fishing license. So this is some of the preliminary data that we have for Indiana otters. And so all of these counties for which we have otter samples have lead accumulating in these otter tissues at levels that are pretty alarming. We've also recently started to look at mercury in otters and in their bones and tissues. And we're starting to see that, these otters who are kind of keystone species and sentinel species that are indicators of environmental health broadly are actually suffering a lot potentially from exposure to these toxic metals. Okay, so then finally that brings me to this, to link in with what Gabe talked about with the HUD grant. We have this citizen science collaboration now with Notre Dame and IUPUI. We're going to continue to provide free soil lead testing, but we're also adding in water and paint as a screening tool to help identify, potential sources of exposure and places where we might look to try to prevent lead poisoning. Our focus will be on Vigo County, and which is a smaller urban area, and then also Vermilion County, which is a more rural area. So we're going to start, hopefully this spring, testing in places like Rives neighborhood, which is just right at the edge of the Indiana State campus. It's one of our kind of priority community engagement areas. And we should be testing there soon. We're looking for community partners. And then hopefully this summer we'll start collecting samples from Vermilion County. So I just want to end with, thank you to the different folks who've provided support, but also to Kathy for helping with all of these graphs, and then Steve, who also helped me with the blood lead levels for Vigo. So I will end there, and thank you for inviting me to be part of this symposium, and I look forward to your questions later.
Thank you so much, Dr. Latimore, for such wonderful work. And I can see Dr. Latimore and Dr. Filippelli's work are quite complementary. And I see Dr. Latimore said you are having a new project and collaborating with IUPUI. And are you collaborating with Dr. Filippelli already?
So Gabe was actually my PhD advisor. So he's the one who introduced me to all of this lead research to begin with. So we've been collaborating for a while.
It's great to have you both here in this room. And I'm sure we are going to have pretty interactive discussions later in QA session. And now let me introduce our third presenter, who is, where is my sheet? Rachel Scarlett. And Rachel Scarlett is a research scientist, ecologist, social justice scholar, mentor, and teacher. She is currently a PhD candidate in the Ecological Science and Engineering Interdisciplinary Program at Purdue University. As an interdisciplinary scholar, she strives to think beyond the disciplinary silos. Broadly, she asks, what are the linkages and feedbacks between environmental and social aspects of urban water, and how are these linkages developed and maintained? Her dissertation is built on a social environmental framework. Social relations and environmental processes are not considered independent, but they are conceptualized as mutually entangled and codependent on each other. Her ultimate goal as an academic is to teach and train marginalized students to think beyond disciplinary silos and engage in culturally relevant conversations on global and local social environmental change. Further, she strives innovation STEM fields as critical to knowledge production on social environmental justice and solving complex environmental issues. With that, I will turn this over to Rachel Scarlett.
Thank you for the introduction. Again, I'm Rachel Scarlett, and today I will be presenting some of my dissertation work titled Stormwater on the Margins. I want to acknowledge my co-authors on this project and my committee members, as well as Charlotte Mecklenburg Stormwater Services and ABE, which is my department. So first, I want to begin with defining stormwater. Stormwater is the water that originates from rain, and you probably interact with it in many different ways, such as flooding of streets near your homes or flooding of your basement, or you may just see stormwater coming out of underground pipes. The question that drives my research is, how do individuals' race, gender, and education level influence their willingness to participate in stormwater management? Oftentimes, Maslow's hierarchy of needs is cited as a useful framework to analyze how environmental concern varies by socioeconomic status. The idea is that environmental concerns are higher order concerns, and people of low socioeconomic status are more focused on basic needs that fall towards the base of this pyramid. However, Mohai and Bryant pointed out that environmental concerns are integrated into very basic needs, such as safety needs and physiological needs. So now Maslow's hierarchy of needs is largely dismissed as a plausible framework to describe differences in environmental concern by socioeconomic status. Although Maslow's hierarchy of needs has been largely refuted in the literature, it's still quite popular to assume that marginalized populations are less concerned about the environment. I'm sharing here a recent study conducted. It's a nationwide survey that analyzed public perceptions of environmental concerns. And they found that for marginalized groups, their self-reported concern, which is in green on this graph, is much higher than their environmental concern as perceived by the public, which is in red on this graph. These groups' concern is largely underestimated by the public, which could influence their inclusion in participatory processes and coalition building when it comes to environmental protection. Recently, studies have started to report that Black residents, people of color within the United States, and women have higher environmental concern than white respondents, despite what public perception is showing. Jones and Rainey decided to investigate why this occurs. They found that Black and low-income residents in Clarksville, Tennessee, were more concerned than white residents about waste, pollution, flood damage, and conditions of local streams and rivers. But they also found that this concern was statistically related to environmental injustices. They concluded that people that experience more inequality in terms of environmental outcomes will be more concerned about their local environment. Moving on from the concept of concern to participation and willingness to participate, there are far fewer studies that look directly at the influence of socioeconomic factors on participation in environmental management. But we do have references from popular culture. In popular culture, we are often fed the story that environmental activities are dominated by white folks, but we need to continue to question these assumptions. This, what I'm showing here, is a recent photo where Ugandan climate activist Vanessa Natake was cropped out of a magazine photo highlighting youth climate activism. So this just goes to show that the media is controlling a narrative about who is an environmentalist. I previously mentioned that there are far fewer studies on participation. In my literature review for my dissertation, I found less than 50 studies on participation in environmental activities related to socioeconomic factors. So this just goes to show that there needs to be more work in this regard. Of the studies that have been done, there are some studies that show that Black people and Latino people and other people of color participate less in recycling, joining environmental groups, reading environmental literature, and environmental recreation. But lately, 2013 reminded us that we need to consider barriers to these behaviors. It is important to remember that there are higher barriers to some behaviors compared with others, and behaviors that require a certain status or expendable income can just as easily align with attitudes of class distinction as they do with environmental concerns. So there's a large issue with the measures that we're using to gauge environmental participation. So far, I've given you information about types of environmental behaviors, but what should we expect when it comes to stormwater? Stormwater is a unique issue because it does not fit neatly into an environmental justice problem. Stormwater hazards align with traditional environmental racism issues like toxic waste regarding the inequitable distribution of vulnerability and hazards. But oftentimes you find that more wealthy communities experience flooding because they live in coastal zones or they live on riverbanks. So it doesn't fit as neatly into an environmental justice problem as other issues. However, we do know that people have daily experiences with stormwater, which can raise public awareness of this issue. On the other hand, we also know that stormwater is driven by very technical knowledge and management, which can lead to this perception that stormwater is not a social problem. And it's certainly not one that should engage the public. It should be something that is left to the technical experts. So my study is focused in Charlotte, North Carolina, where you see the photos here. Charlotte has a growing urban population and economy. However, in contrast to this growing prosperity, in 2015, 17% of Charlotte's residents live below the poverty line, and Black, Native, and Latino Americans are overrepresented in that impoverished population. Compared to other cities in the contiguous United States, Charlotte has the fifth flashiest stream flow, which is indicative of high frequency flash flooding events. Charlotte residents who are historically marginalized by their race, gender, and class are increasingly at risk of and vulnerable to stormwater hazards and pollution because they're more likely to reside in flood zones within this city. We also have evidence that stormwater recovery consumes expendable income and damages transportation systems, leaving many without transit to work or school. And in a place like Charlotte, that could be in small or large storms. It doesn't always have to be a hurricane that disrupts transportation systems. But we also know that service industries are more likely to be women dominated, and these industries are less likely to provide job security during flooding and storm emergencies. So you see that there are some populations that are more vulnerable to stormwater hazards, whether or not they live in a flood zone. Under this context, I have two research questions. The first is, does one's race, gender, and education affect their willingness to participate in stormwater management? And the second question is, does the type of participation influence this association between race, gender, and education and willingness to participate? I look at two types of behaviors, which are willingness to pay more in stormwater fees and willingness to volunteer to clean up local streams. To address these questions, I analyzed 3 community surveys that were conducted by Charlotte Stormwater Services. I created a couple of sum measures of willingness to participate and performed ordinary least squares path analysis. In terms of the demographics of the survey represented the city well in terms of race, gender, and education. This is a summary of my variables. My outcome variables are willingness to pay, willingness to volunteer, concern for flooding. And the predictor variables of concern are race, gender, and education, but we also included control variables in our model, including exposure to educational advertisements, knowledge of stormwater, residents within a flood zone, home ownership, time, which is the year of the survey, and the age of the respondent. So I'm not going to go into too much detail in terms of what the models looked like, but what you should know is that a path analysis is a series of multiple regressions. And these equations are estimated to examine the effect of a set of variables on a specified outcome via multiple mechanisms. So I'm going to briefly explain that in the following slide. So the variables that I'm interested in are race, gender, and education. And this more visual, intuitive look shows that we're looking at how an attitude, concern for flooding, is influencing willingness to participate. And with the path analysis, we can look at two pathways. We can look at an indirect path where race or respondents' race, gender, or education influences their concern for flooding, and that concern determines their willingness to participate. Or we can look at a more direct path where race, gender, and education directly influence willingness to participate regardless of flooding concerns. I went too far. So I'm going to briefly highlight some of the results, and hopefully we can talk more about it in the discussion. But what we do see when we look at race is that Latino, Black, and multiracial respondents are more concerned about flooding than the reference group, which is white. Those with lower education are more concerned about flooding. And we also see that when we look specifically at Latino respondents, we see that they are more willing to volunteer to clean up local streams. However, what I do want to point out is that concern for flooding was not a mechanism that is associated with willingness to volunteer. And we'll see something a little bit different when we look at willingness to pay. But this is just a more visual look at those models. You can see that when you look at these racially marginalized groups, they're more concerned about flooding and those with lower education level. So when we move on to willingness to pay, again, we see some of the same patterns. Latino, Black, and multiracial respondents more concerned with flooding, but we also see that concern for flooding here is positively associated with willingness to pay. And we also see that same pattern with those of lower education and women being more concerned about flooding and in turn more willing to pay more in stormwater fees. So this is just, again, a more visual look. We actually do see this link between concern and willingness to pay. And we did assess what we call indirect effects, meaning that racially marginalized groups, women, and those with lower education were more concerned about flooding, and this concern actually translated into a higher willingness to pay more in stormwater fees. So in conclusion, there are a few takeaways from my dissertation work. I think first we need to consider other measures of participation. In this study, we use measures that were available to us, and we already see differences between willingness to pay and willingness to volunteer. And I think there are so many other ways that people participate in stormwater management that we can start to capture with some new measures. Second, I'd just like to reiterate that people of color and those with lower income are at higher risk of flooding hazards near their homes and just throughout the city of Charlotte. And in our work, we show that people of color, women, and those with lower education level were more willing to participate in stormwater remediation, and their concern for flooding was an essential pathway through which they developed this heightened willingness to pay more in stormwater fees. We also interestingly saw that after controlling for flood zone exposure, these relationships still exist. We suggest that in addition to flood zone exposure, there's this vulnerability to hazards aspect that plays a large role in shaping people's experiences with stormwater and perceptions of stormwater. So like physical exposure to flood zones, vulnerability to stormwater hazards are also driven by structural forms of racism, classism, and sexism that create and sustain these debilitating patterns of unequal wealth distribution, access to loans, and access to transportation that are critical when responding to a flooding event. These analyses have considerable implications for how we theorize the interplay between inequitable distributions of environmental conditions and actions to remediate those conditions, even in highly technical spaces where public participation is unconventional. We saw that socially and racially marginalized individuals were driven by their concerns for flooding to be more involved in shaping their future relationship with stormwater. With that, I would like to thank everyone for listening to my talk, and I'd love to discuss all of this work with you all. Thank you.
Yeah, this is such important work. We look at community's exposure and community health, working with community, not on community. We work not only in community, but also need to work with community. This is such an essential component of our work. And Dr. Filippelli and Dr. Latimer describe their work and present lots of data, but without community participation and community support, those data are almost impossible to reach this level. So I'm glad we have Rachel Scarlett's work introduce a little bit how to see these issues a little bit from community's perspective. And I know in this audience, we have experts in storm flood measurement and policy evaluation in that field. And I look forward to a very interactive discussion. Before we open the floor for questions, I would like to introduce our discussant panelist, Dr. Alan Wells. Dr. Alan Wells is an associate professor of environmental and occupational health at Purdue University in West Lafayette. Dr. Wells conducts environmental epidemiology research related to metal and endocrine disruptor exposures and their relationship with neurological and cardiometabolic health, particularly among children. Dr. Wells also teaches courses in public health epidemiology, environmental epidemiology, and environmental health science. Dr. Wells, would you like to provide some comments before we open the floor for questions?
Sure. Thank you very much for inviting me to be a discussant for this panel. I think this is a very important panel. We're discussing some topics that are very close to what I research a lot too. So obviously I'm interested in it, but I think they're also interesting from a broader perspective of environmental justice and environmental health. And I made a couple of notes while everyone was talking. So what I would like to do is highlight, I think, what are several key themes that were brought up in several of the presentations today. So common themes among all the presenters, as well as one or two issues I thought of that we could touch on in a little bit more detail in order to expand all of our horizons. So to get started, one of the things that I kept hearing throughout the presentations was highlighting the issue of legacy pollution and the issues of how existing structures and procedures with how our communities are built and how our industry has been developed really has driven us to the point we are today, with lead exposure being a big problem and with stormwater systems being a big problem. These are all the result of decisions that were made dozens or even hundreds of years ago when we first built up our communities, and we're still dealing with those problems today. And that's one reason why they've been so difficult to address. So I wanted to emphasize that I was bringing in with this session, along with the previous session, we were talking about history. I think the history of how our environment's put together really affects the way that we are exposed to all these pollutants again here today. Okay, so the second theme that really jumped out at me was the emphasis on engagement and participation. All of the speakers really emphasized this part, and I think with good reason, that we need to, for this work to be highly productive, it's important to engage with people across various disciplines. So most of the presenters talked about how they're working with different organizations from different disciplines or different academic areas, and also with community members in order to make this work really happen. And I think that's important too to recognize, because these problems are legacy problems and structural problems, that looking at them from different angles can help us figure out new ways to address them too. And within the engagement and participation, all of you really emphasized working with the community as a major part of this. And I'd like to highlight that as well. I agree with all of what the previous presenters have said, and I'm trying to do that with my own work too, in engaging community, because for all the reasons that were mentioned, that engagement with the community can help bring more education and empowerment to community members. So education about the science, education about environmental justice, about environmental pollution and their effects on health, so that people are aware of the issues that are faced, and with the education, providing an opportunity for them to gather their own data that can then make a difference, really helps improve, can help improve agency among populations and participation and a willingness to get things done. And Dr. Filippelli, if you have that data that you mentioned on improving self-efficacy in populations, I'd love to see that in a little bit more detail at some point. Okay, so those were some really key issues that I thought everybody shared. Some other issues that I thought we might be able to bring up maybe in the Q&A or even later on are more of an emphasis on the health concerns too. So I'm coming at this discussion from the lens of a public health expert and an epidemiologist. And while I too have done a lot of studies where I look primarily at exposure and disparate exposure among populations, I think it's also important to remember that one of the key features of this is that we're concerned about exposure because it ultimately does affect health. And I'm bringing that up because in my own work and research, I think it's really common to find research that looks at the exposure component alone or at the health component alone. So there's a lot of work showing that there are disparities in exposure, and there's a lot of work showing that there are disparities in health, and there's less work that bridges that entire gap, I think. And that's an area where I think that we could look at in more detail. Another area to look at was the range and extent of the pollution, toxin, health, and justice issues. I like how, because we were talking about a limited number of pollutants or environmental hazards, we really got in depth into that with this discussion. But I wanted to recognize that there's a lot more to environmental pollution and environmental justice than just lead or stormwater or structural activities. And it's a really complicated problem. And again, I think this is an area of uncertainty in that we don't know the full extent of the complexity of the compounds that we're exposed to, or that there are disparities for, and that the disparities can be complicated by, you can have disparities of exposure to the number and quantity of pollutants or toxins that people are exposed to, but you can also have disparities based on the fact that some populations are more vulnerable to effects than others. And many times when we're talking about environmental justice, some concerns I've been thinking about lately are that one reason we're so concerned about this is because the environmental pollution is not the only problem they face. A lot of the other sessions we're talking about social issues and social injustice on top of the environmental justice. And when you lay those factors on top of each other, like educational opportunities, social opportunities, and then the environmental pollution on top of that, it can really add, multiply the effects. And again, that's something that I think we have an idea that that's a problem, but we don't really know the details of that yet. So it's another kind of big unanswered question. And then one last point is that while listening to all of these, one of the questions I had was, how can we start to think about solutions to these problems? So we know that lead is a problem. We know that stormwater is a problem. We know that siting of landfills or other unwanted land uses is a problem and cause environmental racism and environmental disparities. But the situation that we're in today, and again, this is building on the history, a lot of this is developed over time. So historic use of the land led to contamination, which has also led to where people are living on today. So one of the things I think it would be helpful to think about, not easy to do, but helpful to start talking about and figuring out how we can break that cycle that's led to the situation that we're in order to create more positive change in the long run. And I know I asked a lot of questions and brought up a lot of things that are really, really big challenges, but I think it's a good starting point for conversation.
Thank you so much.